On today's World Insight, Impartial international efforts to get to the bottom of the pandemic source. What will it take to get a professional fact-finding mission on track in the spirit of cooperation?
At least a year or more until the pandemic is over before we truly have answers on this.
And the science behind an inquiry into COVID's origins, details from a group of well-respected medical experts and scientists.
Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei. As the COVID-19 pandemic still takes a heavy toll, the world sought answers to its origins. It's good sense to leave tricky jobs to the professionals. China looked to the World Health Organization to treat the coronavirus origin tracing work as a scientific probe, guard against political interference, and seek answers across regions worldwide. China was the first country to carry out joint research on COVID origins with WHO. Earlier this year, for example, a 34-member WHO China joint expert team carried out a 28-day research mission in Wuhan. On March the 30th, the WHO issued a joint report which came to clear conclusions and provided science-based recommendations for the next phase of the study into global origins. So how could scientists cooperate on the serious scientific inquiry? And what can keep away polarization on political lines, which only create more hurdles in finding clear answers? Let's loop in our panelists from different parts of the world. For investigations on the origin of COVID-19 in Washington, D.C., Kate Tulenko, CEO of Corvus Health in Seattle, Dr. Alice Kim Kang-tan, internist at the Ms. Medi Women's Hospital from South Korea. In Shantou, China, Dr. Hua Chen-Zhu, associate professor from the State Key Laboratory of Emerging Infectious Disease from University of Hong Kong. Great to see all of you ladies, and I'm glad this is a discussion among ladies. It means that women are really in the front line of both research and the medical world. Congratulations to all of you on that. Having said that, though, you know, the trace of the origin of COVID-19 is such a complicated issue. Many wonder what are the timelines that we should really look at in terms of when we could have any results. Dr. Tulenko.
Yes, I think as far as the timeline, it probably will be at least a year or more until the pandemic is over before we truly have answers on this. Because with the pandemic still raging, it's a problem of access to people and not wanting to expose people and put them at risk. But I do think that the WHO has the proper expertise on their panel, but the WHO has expressed concern about not having access to the people and the places that they've wanted to really properly investigate the origin of the pandemic.
Dr. Zhu, as far as I know, there are quite a number of people, for example, in China, that has been advocating not only to do investigations and research of the trace of origin in China, because the virus has no boundary, but also go to other places. When there were earlier cases apparently look alike COVID-19 were reported in Europe, Italy, for example, in the United States as well. So how do you see this, the scale of investigation and research?
Absolutely. We need to have the investigation, not just in China, but also outside of China, because this virus is actually quite broadly spread and distributed in the world. So we have to know more about this virus. And actually, there are more and more evidence pointing to the possibility that this virus may first occur in regions other than China, or probably it could be that like there are multiple outbreaks here and there, and Wuhan is just one of the epicenter at the very beginning.
Interesting. Dr. Chen, of course, you and I have been talking about the pandemic from, at that time was still an epidemic from earlier stages. And we see how scientists have been trying to work together. Things are getting more complicated when politics involved. But looking at the COVID virus and the earlier, 100 years ago, the flu, for example, how long the investigators and the scientists took to figure out exactly what happened. How are we going to be smarter this time in trying to design a roadmap and also to design a way of thinking for the research and so-called investigation?
Well, I think it was July 16th when the WHO talked about the introduction of a scientific advice looking into the origins of novel pathogens, including the SARS-CoV-2 virus. And they put forward 5 different areas of research that need to go on. And I think it's simultaneously. They are going to be doing research into what they call a One Health approach to looking at disease. And it's an integrative perspective looking at humans, animals, and the environment and the interface and the intersection of all 3. They're also going to study looking geography. Do we need to look elsewhere? Geographically, they want to target the areas where the outbreak first occurred, but also I think the Rhinophilus bat is a bat that seems to carry a virus that's very similar to the SARS-CoV-2 virus. And so they're looking at geographical regions where a host animal, a natural reservoir might be living. And then they're also going to be looking at studies into the animal markets, I think, near Wuhan, and animal traceback studies. Lastly, they do want to do audits of relevant laboratories as well. And I think the reason why is because even though this was the least likely scenario, they just want to leave no leaf unturned in terms of possibilities of origin. And that's kind of the roadmap that the WHO has put forward. And I think it's going to be a very complicated task, multifaceted in nature, and in terms of timeline of when we will be able to find the cause or the culprit pathogen. For SARS, I think we were just lucky in finding the civet cat, which was the host animal for that virus. But with SARS-CoV-2, more difficult. We may need to look harder and broader.
After even the pandemic broke out, we see different countries have very different approaches. So one might also ask, when the first outbreak was identified in China, whether there could be negligence elsewhere in the world about the possible small-scale community transmission and things like that. In that regard, one could also ask, so what should be, the investigation or research about COVID-19 in the world today regarding its origin?
Early identification of an outbreak. And so that's a rise in the number of people dying. And so to identify that there is an outbreak actually doesn't take a lot of scientific muscle power.
No.
It really is just counting the deaths and looking at excess deaths. So I don't think that there was a significant outbreak elsewhere that was unrecognized. Whether or not the virus originated in China, I do think the first major outbreak was in China. But I wanted to say a thing about sort of the politics of this. There's been a lot of finger pointing, blaming different countries or different institutions. Basically, understanding that the most important thing is for us to find out what happened so we can prevent it from happening, and also sort of get closure, and not say, well, someone has to pay, or someone's going to be punished. And I think that is really the most healthy attitude, and the attitude that will help the world work together better now and in future pandemics as well.
Dr. Kim Kyung-Tan, I want to have the same question to you as well. I know it's difficult for scientists to take positions now, and it's unfair, in fact, for them to take positions according to politics. But even from a science perspective, how collective this research should be in terms of the origin of the virus. The scale and the speed is one thing, but the origin is another thing. These are two very different issues. We see two arguments. One is to concentrate on one country where the first known outbreak took place. The other argument is about whether we should further investigate some of the biggest possibilities of origin and scale up a bit so that we could have different information coming in rather than just focusing on one country, one outbreak. So this is a very different approach, but I want to have your opinion.
Well, this entire investigation needs to be collaborative. It needs to be international, unbiased, data-driven, and transparent. And that's really the only way forward. When there is a big problem, a crisis, the most important thing is to troubleshoot and figure out what happened. The most important thing is not to blame people. And most of the time in management, it's also quite well known that a blameless environment is one that is going to engender transparency, and it's going to encourage people to be open-minded and to speak up when there are problems. And I think that's the way that we need to approach searching for the origins of SARS-CoV-2. In terms of where to look, and the where and the when of how the pandemic started, I think the initial investigation that happened in January, February of 2021, the WHO and China joint investigation team, they started investigation into this, looking to see, in terms of when this might have started. Did it start prior to December 2019? And they've been able to limit that time frame of when this may have all started to at the latest maybe, or at the soonest, mid-November 2019, and most likely December. So that's the time localization. In terms of geographical localization, as I said, they are considering places where bats that carry viruses that are similar to the SARS-CoV-2. They're looking at those locations in Southeast Asia, in East Asia, in China, but also they mentioned the possibility of the frozen food, the cold chain, and possibly animal products or infected products being delivered into China, into Wuhan, and that starting the infection. And so I think looking broadly is the right approach. I don't think we have enough information to really zone in on one area right now. And this whole investigation is so important to carry out for three reasons. First of all, the pandemic's not over. It's been 18, 19 months and it's still not over. And discovering the origins and possible animal reservoirs will help to elucidate what is going on and perhaps prevent further spillover, zoonotic, what we call animal to human transmission. Secondly, trying to figure out what happened will be so informative to prevent the next epidemic and pandemic of an emerging pathogen. And then thirdly, that will give some sense of closure, I think, to all of the millions of people around the world who have suffered, endured this, the millions of people who have lost loved ones, including 7,000 healthcare workers who perished in the front lines working through the pandemic.
This is a very difficult investigation and very difficult research. As we said, from day one, politics already coming in and makes the international organization in a very difficult position, and also makes geopolitics playing a role. Dr. Zhu, we see the exchanges of words between China and the United States, for example, regarding the laboratories. The US was advocating go and research about the Wuhan laboratory, even though there were discussions already taking place with the Chinese scientists by WHO and others. Dr. Fauci even also earlier, a few months ago, mentioned about that, the slightly slim, very slim possibility of coming from any laboratory. Also, China has been asking why the international community hasn't investigated the United States. Some of its laboratories also have the capabilities of spreading and also coming up with virus that's similar to COVID-19. Well, that's my interpretation, not necessarily the words by word coming from the Chinese government. So I didn't have a direct quote, but the meaning is something similar. So Dr. Zhu, how much should these laboratories around the world, I mean, the one that has the level of a Wuhan laboratory and above, be investigated? How much do you see the capabilities of human-produced virus in terms of its possibility to COVID-19? Dr. Zhu.
Okay. So I think that the problem is that when science is absent from the unknown or those not well understood phenomenon, it gives some space for the conspiracy theory. And theoretically, any laboratory which possess the infectious material, they can be criticized or be suspected for this kind of possibility, not just the Wuhan Institute of Virology. Any laboratory that has animal samples, either from bats or the other kind of animals, they may have the possibility of handling, manipulating the samples. And I have a concern that for those laboratories that do not have a biosafety level 3 or 4 facilities, there might be even higher risk theoretically. Yeah, so I think that if there's no evidence, but we are just suspecting each other, that will create a very toxic atmosphere. And this kind of stigmatization is actually not friendly for anyone. And it will make the scientists quite hesitating in whether I should do this kind of work. For example, for me, now I have the feeling that, previously, we have been working on the source tracing of MERS, of many influenza viruses, and even SARS. So we have a lot of samples here. What if one day people criticize or suspect that there might be something happening and related to us? Then how should we explain that? So I think that first we need to stop this kind of passing the buck or criticizing each other without any evidence. And more importantly, I think that scientists should take the responsibility to do more works. For example, if we can figure out what would be the immediate precursor virus related to the SARS coronavirus 2, then you will give a more reliable or solid evidence that the nature origin might be much more possible. So let's take SARS or the MERS as an example. So actually, our team did a lot of work there. So previously, there's also lots of suspicions and also conspiracy theory. But after we collect thousands of, tens of thousands of samples from the wild animals, then we also conduct the sequencing. And actually, I should say that the genome of a virus can talk, can speak for themselves. If you conduct the evolutionary analysis, it gives you the exact date how this virus or when this virus emerged and how it can be transmitted between the different individuals or animals. So I think absolutely we need more solid evidence from the scientific community. And also the better surveillance we do, the more evidence we can provide. And that will make the space for conspiracy theory like limited. Yes.
Dr. Tulenko, your final thoughts before we wrap up.
Well, I think that, one of the questions we were asked to look at was, what sort of research will come out of this? And I think there are 4 streams. One is the basic bench research on the virus and understanding how it replicates and how quickly it creates variants. But also there'll be a separate line of research on, medical interventions, antivirals and interventions to calm that inflammatory storm. And then there'll be one on vaccines. And this is a really exciting time because the COVID pandemic was the first time that both mRNA vaccines and the adenovirus vaccines were used commercially. So I think we will see a golden era of vaccines and more vaccines against infectious diseases and possibly against cancer. And then the 4th stream of research I think we can see coming out of this is the non-medical interventions. That that's the mask wearing, the social distancing, and how we can better protect people and getting the evidence for that. Because one of the main barriers to being able to institute mask wearing was the lack of evidence that mask wearing is effective.
Kate Tulenko, Alice King-Kyang-Tan, Hua Chen-Zhu, thank you so much, ladies, for joining us and helping us understand your insights and expertise. Thank you, really appreciate it.